Good afternoon, Europe. Good evening, Asia. Good morning, North America, where we're joined from North America, Jay Newton-Small, who is the founder, CEO of MemoryWell, an incredible service, which she'll talk about in a moment, helping seniors to combat many challenges through the power of storytelling. And today we'd like to hear from Jay about seniors in general and what she's seen. Jay has a very distinguished career as a journalist before founding MemoryWell. And so I'm expecting lots of great observations, Jay, in terms of the impact of COVID, the lockdown and other elements on the senior members of our society. From your point of view, what is the biggest impact we've seen so far?
Well, Thomas, so great to see you, and thanks for having me on. And I think we've seen quite clearly there's been that seniors are the most affected population of the COVID-19 coronavirus, and that is incredibly scary. Certainly in the United States, nursing homes have been ground zero for the disease. As New York Governor Cuomo said last weekend, it remains their top priority. It is, and that's because as soon as it gets into one of these nursing homes, it quote unquote spreads like wildfire. And then suddenly, you have dozens of residents infected, dozens of staff members infected, and it's very, very deadly for that senior population, most of them who already have underlying conditions such as heart conditions or breathing conditions. And so they're particularly vulnerable to this disease. And so you've seen all this, not only a ton of, very tragic deaths, and a lot of the deaths in the United States have come from nursing homes, but you've also seen families completely separated and isolated from those seniors, which I think is equally as tragic. And there's lots of footage and stories in the United States of people going every day to their mother's nursing home or their father's nursing home and standing in front of the door and having to communicate with them through glass or through windows, and not being able to help them and caregive for them the way that they usually can. And it's really heartbreaking. So not only are seniors physically isolated by this disease because they have to be quarantined, but they're also socially isolated. A lot of them might have hearing issues. They can't use communication devices in the same way that we can. And it's really hard for them to sort of go day by day without that family caregiving support, and without that social support.
So there's the actual physical problem of it, which is the mortality rates. This is something that is killing off senior citizens. We're now seeing really, it almost feels like an age-related disease in some levels, COVID, as we see it, see its evolution or our understanding of it evolves as much as anything else. In terms of this social isolation, there's the challenge of not having these digital tools, the physical separation. What are the ways that you've seen people tackling that in the best way or most effectively, this social isolation part?
Well, so Thomas, before this even began, we were experiencing an epidemic of senior isolation and loneliness and depression. And you saw seniors, frankly, committing suicide at higher rates than we've seen in a very, very long time, in a very worrisome trend. And there's a recent AARP study that found that social isolation and depression among seniors was actually more deadly than smoking 15 cigarettes a day. And so this had already been a problem before this started, and that's because the Affordable Care Act had really successfully incentivized people to age in place. And that's a good thing because it's less expensive to care for people when they're living at home. But the bad side effect of that is that when they were living at home and their friends would die off and their potentially spouse would die off and they don't have family visiting or family nearby, they would have less and less excuse to leave the house. And then suddenly they would find themselves almost living as shut-ins with no external contact. And that really does create a dangerous situation of depression. And so that's been clearly exacerbated by this disease. Something like 15% of seniors feel even lonelier than they did before this. And according to, there's a poll by Senior List that they do monthly. And that's just within the first month of the isolation. So we haven't even gone into month 2 yet. And I think that, it's really hard because, again, without those communication tools that are specifically set up, they can't use technology. If they don't have help in their community to use technology, they're often at a loss on how to use those smartphones that we all carry around with us all the time, or how to use those even like, iPads or communication devices.
Skype, Zoom, or any other tools like that.
Yeah. So the ones I've seen, I think the tools that we've seen that have been the most effective have been ones particularly geared towards seniors. For example, there's two systems, one called Independa, which is developed sort of in collaboration with Comcast, another called It's Never Too Late, IN2L, which have these big, massive touchscreen television.
It's Never Too Late.
Yes, It's Never Too Late, IN2L. They have these big, massive touchscreen, either televisions in their rooms that are built for seniors. You can touch them. They have these remotes that are built for seniors. And they also include communication systems within there. So they can video chat with family off of those systems. They can connect with family off of those systems. The IN2L app is a little bit new, so I think that's just starting out, but Independent has been around for a while, and like big chains like Sunrise Senior Living use Independent. And so that's one way that I've seen seniors connect. MemoryWell also made its own, our software free and available for anyone to use to help address this. We're a storytelling company, but we have this timeline that goes with our stories that helps families build on the stories that we write. And we just basically said, look, we want to be able to give everybody the ability to connect with one another. And so what we've seen is communities take this free tool and basically say, great, and they'll send, an intern, or they're, like a nursing intern, or they'll send someone else in the community down the corridor to just do little video interviews with every single resident. And then they can post those interviews to each resident's timelines, and then families can interact with those timelines. And so they can comment on them, they can post their own photos and videos of birthday parties and things that grandma might be missing. And it just is reassuring to see that, look, your loved one's great, they're doing okay, here's them doing an activity or whatever it is. And we found that it's a really popular solution because instead of having to email every family, or that nurse assistant might not be on duty the next day, the family doesn't know who to get in touch with. This way, it's all there for the families to see and interact with, and it can be a broader extended family. And then also whichever staff member is there and interacting can also post. And so,
just to be clear, so this is posting it to the entire senior care facility has access to it?
No. Actually, these are individual. Every resident has their
accounts, right?
Yes, and so families just see their individual residents' timelines, and sort of can check in that way. So it's private. It's it's all sort of secure. It's completely private. None of these are public. And the idea is that everybody has their own sort of little communications tool and timelines, and we send reminiscence questions to engage them with. So like, where were you during the moon landing, or where were you during the end of World War II, or what do you remember about your own grandparents or your first summer job? And that sort of just helps prompt different memories. And then with the timelines, we built them out specifically because frankly the stories that we tell are very short. And when we started to do our stories, families came back to us and said, we really love them, but when we send them to our extended family and friends, they see all the things that we're missing. Uncle Joe wants to add the time when they went ice fishing in Michigan and whenever hilarity ensued. And so they were like, we want to be able to add to them. And so we gave them these timelines to be able to add to them. And it became this really popular addition where they could keep going and going and going. And, they saw the stories and then they had all these questions. Grandkids were like, but wait, I want to know more about grandpa's military service, or I want to know more about X, Y, and Z. And so those timelines really meant that the stories that we were doing became the beginning of a much longer family conversation that then you could engage with over the timelines. And so that's similarly, I think you see, this is sort of a novel use for those timelines where communities are using them more as like an almost everyday check-in, like here's, grandma doing these activities,
Right.
But you can use them for all different kinds of reasons, just sort of being able to chronicle different, whether it's your current life right now or your past life or even your future life, what you want to do, hopes and dreams. Like when the coronavirus is over, I want to go travel and see my son Johnny in London or wherever, and so and so it's really just a kind of platform where they can kind of add anything they want, videos, music, photos, things like that.
So we have a few comments coming in. One of them is a question from David Mayo. He's saying, is there a way to gamify staying mentally fit and physically fit through your timeline, perhaps?
That's actually a great idea. And in fact, we just are about to add a live video component of it, which will have these sort of little karma points that you can get. And if you sort of do different activities, like record certain messages or challenge somebody else, like in your family, to record a message, or somebody else challenges you and you answer, you can get little karma points. And then eventually we're going to have prizes that you can win. So we've already gamified, frankly, the back end of the system where the paid staff interact with our stories. And this way it sort of makes it fun for the front end users, the family users, and the residents themselves to win things and be able to make it just a much more satisfying experience, I think, overall.
So we've spoken about the emotional challenge, the first physical one, the health challenge. We've spoken about the emotional element to it. There's another challenge that this sort of brings out, which is sort of this intergenerational challenge between the different, generations. Where are we going to see more conflict, or are we going to see more distance? I mean, physical distance, and what do you see as the impact of that going forward?
Well, Thomas, it's interesting. I was already before this writing a story, and it's a long-term, as you know, magazine story, stayed forever, story about the rise of the four-generation family, right? So we are, up until this point in history, really, it's been much more traditional that 3 generations were alive at any given point. But considering the amount of success we've had in extending human longevity, it's actually really common now to have 4 generations alive. And what does a 4-generational family look like, right? And so, and I think it's a super interesting question, particularly because the pieces of the pie that we're talking about in terms of splitting our world resources haven't grown. So when you have to split it between 4 generations and 3, it creates intergenerational tensions that I think are really fascinating. So in the United States, even before coronavirus started, earlier this past year, late last year, there was this whole sort of okay boomer, okay millennial tension going on, where millennials were sort of blaming boomers for not having the resources they want to succeed, right? Like, so boomers are not moving out of their homes, they're aging in place. The housing market is incredibly tight in the United States, or was before the coronavirus. And so millennials couldn't afford to buy homes, right? And so it's just there wasn't enough around to buy. And so that's just one example of the ways in which this is having a big impact. Now, I think that actually is driving a lot of really fascinating intergenerational play. So, for example, we've seen a really big rise in the United States of intergenerational living. So millennials moving in with grandparents to help them as they age, grandparents helping with childcare. The house is already paid for. And it sort of brings us back to that kind of nuclear family unit that we haven't seen, particularly in the United States, in generations, because most generations got here and then immediately scattered across the country and moved cities and went to college, and and now we're seeing families kind of come back and live together again in one place, and it's fascinating to see that interplay. And I think that COVID will hasten that, as you see people increasingly reluctant to put seniors into care, because knowing that these nursing homes are the sort of epicenter of the disease, and they have to care for them at home. How do they do that? And how do they incorporate, the needs of the various generations, the millennials and the boomers and the Gen X's and the greatest generations and the Gen Z's? Like, how do you sort of incorporate all of those needs and work together as a family unit collaboratively to succeed?
Yeah, another element to that, actually, well, 2 elements to that. One is, while they are bringing them home and away from these care facilities, they're going to have to find the right way to manage that care themselves and ensure that they don't bring infection in other ways, which I'd like to talk to in a minute. But sticking still with the intergenerational element, I mean, you're seeing almost a return to what we still have in more traditional societies. Klaus Nemzo just wrote here saying, in countries like Vietnam and the Philippines, where families include several generations, isolation might be less of an issue compared to the West. Isolation is less of an issue in terms of they're all under the same roof, so that social element, but they're also going to face those challenges in dealing with that, with the evolution of COVID, in terms of making sure that the seniors don't catch the disease from the teenagers who don't appear to have it.
Yeah, no, absolutely. And that's the biggest threat right now, particularly for a lot of these senior living communities, is you have a lot of younger people who are asymptomatic, and it's really hard to screen. And you can test temperatures every day, and you've seen a lot of nursing homes test their staff temperatures, test for symptoms, and still get the disease in their communities because people are asymptomatic. They come into the community, and then all of a sudden everybody has it, right? And it's much deadlier to the senior population than it is to younger caregivers. But you've definitely seen, I think that I've emphasized the positive aspects of, potential intergenerational interplay where you have, families taking care of one another. There are also negative aspects. You saw Texas Lieutenant Governor Dan Patrick basically say, well, hey, we're trashing our economy for these people, for these seniors who, it's frankly better for our economy that they should die. And he's like, they're older, they're stuck on our resources. And, he's like, I'm older and I want to die for my grandchildren. Like we should be allowed to lay down our lives if we want to, for the economy and for the sake of our grandchildren, which is like, kind of a crazy thing to say. And there is this perception, which is actually false, that somehow seniors are these, simply this like, drain on the resources, that they don't give to the economy, that they are not useful in society. And that's patently not true. In fact, 70% of disposable income in the United States is controlled by people over 65. And so they actually manage most of the money in the United States. They have most of the power, which is largely what was causing a lot of the baby boomer and millennial kind of clashes, was that they have not let go of those resources as they've aged, in a way that we used to see when people retired. They were sort of like, okay, I'm done. I'm going to go off and play golf in Florida. You see people working a lot longer. You see them maintaining those jobs longer. You see them not leaving the workforce, or just even working part-time longer. And that has, like I said, reduced the share of those jobs and those resources for future generations or later generations. And that's in part what's causing this generational tension.
Going back to the housing for seniors, what do you see as the major changes that are going to have to take place? They've already started putting in emergency procedures, clearly, to, in the pandemic. But going forward, how would you see these communities, which is there are a vast number of them, no? It's a large industry, in fact. How are they going to have to adapt, and what is that going to mean for them going forward?
Well, there are 90,000 senior living long-term care communities in the United States between and I say that between skilled nursing, which is mostly Medicaid patients and that are run by states, and senior living, which is assisted living, combined. And so it's roughly a population of just about 2.5 million people. And that is, I would say that this is, we're definitely going to have to rethink what senior living looks like moving down the road. And there are smarter people than I who are thinking of this, but I've certainly heard different suggestions, ideas. So for example, there was already this trend to move to smaller communities, right? So have a community of 6 in a house, and or maybe 5 or 6 people, make it more like a home.
And the 6 in a house would be separated. It wouldn't be 12 houses around the place. It would just be a single house of 6.
Yes.
In place.
That's one idea, is to have like smaller communities of seniors where it's a less number of people coming in and out, right? You only need maybe 2 or 3 caregivers for those 6 seniors, versus like, a 300 person skilled nursing unit where you have a staff of like 140 that come in and out, and the risks of the disease, spreading in a community like that are much higher than, a smaller house of 6 people with 3 people coming in and out, right? So the idea of smaller communities, the idea of more people living at home with their families, like the intergenerational idea that I was talking about. And then there's also there's a guy named Dr. Bill Thomas who started the Eden Alternative, the greenhouse movement, which is all about putting person-centered care into senior care. So really treating seniors like people and not like diagnoses. And he started a company that does, for lack of a better word, they call them granny pods. And, and you have like a big property in Florida or Arizona where the weather is nice, and each person or a couple has their own little teeny pod, right? And they have all these little pods across the property. It's really effective because you can isolate those pods when there's illness. you can bring them food and leave the food for them. You can bring them things, and they can be isolated and cut off. They have their own HVAC systems, their own sort of heating and cooling systems, but they can also come together in times of health, right? They can have a community center, communal pools, communal sort of recreational areas. And so it's a way that is much safer to control for larger sort of 20, 30, 40, 50 people or living in one place. But the problem is that might be great for, states with a lot of land, or states, suburban areas or rural areas. For seniors living in New York City, that's clearly not a possibility. And so I just think in general, we're really going to have to rethink in the United States. And in fact, just yesterday, the president created a commission on the nursing crisis, which I think will morph into a longer term sort of really think through the issues of, is it smart to collect all of our oldest and frailest in one place? And if we do that, how do we protect them? How do we make sure that not only are they healthy physically, but also healthy mentally?
Okay, and great. You actually hinted on the next topic I'd like to hear a little bit more about, which is the nursing. What does the future of nursing look as with what we know of COVID so far? There's going to be obviously more learnings going ahead, but already we have a baseline element of what's going to have to adapt. How do you see that changing in terms of nursing care for seniors?
Well, I think certainly the leap to telehealth has already happened, and the one sort of silver lining, or one of a few silver linings, I would say, that COVID has done for the U.S. healthcare system is really force that leap to telehealth. I mean, telehealth has been kind of lingering and around, and people keep saying it's the future of medicine, but it hasn't actually happened for decades, and it should have happened a long time ago. We should have been able to do telehealth 20 years ago, frankly, the minute we were able to Skype with one another. And but we had HIPAA, which is in the United States, this law which protects our health privacy information. And HIPAA is very stringent. It's very expensive for doctors to end-to-end encrypt, and you can't just use things like Skype. You can't just use things like LinkedIn video. And so I think that what it has forced is that leap to telehealth. And so now all of a sudden, doctors, they've sort of waived all of those privacy considerations across the board. And they've said doctors can consult on anything they want: telephone, Skype, LinkedIn, Facebook Messenger, whatever you want to use, you can use. And that's really, I think, been a really positive step forward, because, really the vast majority of nursing issues are things that can be dealt with virtually, right? And so, you're there are really small things that most women know when you have a urinary tract infection, and you can just say to the doctor, I know the symptoms, can you just please send me a prescription? Most people know if they have poison ivy and they've had it before, and you can just say, go to the doctor and say, here, I was out running, or I was out gardening. I know I have poison ivy. Please send me a prescription or some medicine for it. And it's those little things like that, I think that takes the relief off of the urgent care systems, right? So people aren't bringing their kids in for, all kinds of poison ivy or whatever it is, ear infections. They can just do it all remotely, which then reduces the overall burden of the system and allows, I think, doctors and nurses to focus on the sickest, which is a much better system. I think you're going to see
this is what you're talking about, is a streamlining and specialization, pushing up the level of gravity of something that would prompt you to go to a health facility.
Yeah.
Which comes to the question of, for me, when you talk about telehealth or telemedicine, I have in my mind maybe a robot doctor or something, but you're saying it's not that at all. This is basically a triage of the low-hanging fruit, which is, I don't know, a large portion of what from what you're saying, it sounds like it's a large portion of what people are going to doctors for, taking up maybe valuable time.
Yes, absolutely. And so you're getting rid of a lot of the lowest hanging fruit, a lot of the most basic, the sort of everyday kind of maladies that we might deal with as a population, freeing up doctors and nurses to attend to much more serious issues. And I think that, we've seen hospitals in the United States really build for the boomer generation, and they've built out these super luxurious wings where a whole generation of boomers were going to come and get hip replacements, and it's going to be, and do long-term rehab there. I think that COVID really changes that sort of calculus, because no one is going to want to spend long-term, time in a hospital at this point when COVID is around, especially for seniors. I think you're going to see hospitals really switch, and we've already seen this. We work a lot with palliative care and with hospice, right? And so hospice has already seen a huge uptick in the number of children, for example, being put into hospice care. Now that seems counterintuitive, but in the United States, hospice isn't just for the dying. And if you're a child, you can go into hospice care, these are qualified long-term caregivers, right? Like nursing caregivers. So you can do hospice for a child who might recover, and so they've been putting a lot of the children that would otherwise be kept in the hospital for longer stays into hospice for them to recover in hospice and then go back home again. They've been putting a lot more patients into hospice, like elderly patients, people they would have kept for a lot longer hospital stays. They've been moving them out much more quickly because of COVID. And I think you'll see that trend continue where people will spend a lot less time in these lengthy hospital stays for whatever reason. And you'll see hospitals go back to being the kind of really just simply urgent care centers that they are, right? Like that they should have been to begin with, and not these sort of long-term rehab kind of centers. But that's where a lot of hospitals make a ton of their money is that long-term rehab. And so I think fundamentally we're going to have to also look at like what is the business model for hospitals, and what's the business model for long-term care? When does someone go into long-term care? How do you secure that facility? How long do they stay? And then whenever possible, how do we move someone out of long-term care? Because you obviously want them out of these group living situations as quickly as possible, whether it's long-term care, hospital stays, and really get them into a place where their health, their exposure to COVID can be limited.
Right. And I think that question of what is the business model for healthcare following COVID is a very important one. In the latest GDP figures for the United States, which went down, I think something like roughly 5% or so, a huge portion of that was actually on the healthcare side, more than 2%. And people attributing that to people not doing elective surgery, for example. These sort of things will really be called into question in the new era, I'd say.
Absolutely. And I think you'll see a lot more specialty centers, right? So, instead of a hospital generally where everybody goes for all different kinds of ailments, you're going to see, okay, you have diabetes, we're going to do a diabetic center where, we're going to do dialysis. And if you have some sort of shock, some sort of complication, we'll have attached to that, a place where you can stay and get treatment for that diabetes, potentially renal failure, sort of all kinds of kidney issues, get kidney surgeries potentially, but like have those sort of be just specific to diagnosis, or cancer centers where people can go and get cancer treatments, chemotherapy. And that way you're not like potentially encountering people with COVID, people with other diseases. It's a little bit more specialized. And I think you'll see hospitals kind of tend to move towards building those specialized centers where people can feel safer about getting treatment for their underlying conditions, potentially even have longer stays in those centers and surgeries in those centers for their conditions, but not have to go to the main hospital where they're treating COVID patients, they're treating all kinds of other complex comorbidities.
Which is interesting because that sort of brings to mind the model of some private healthcare facilities in India where they have a hyper specialization on a particular procedure, which allows them to do it in a very automated way or a very systematized way, reducing the level of the people who are involved in it, making it fewer expensive doctors, and having very highly effective outcomes. On the other hand, what we've seen is the value of having doctors who work in a team and look across the full spectrum of elements that are feeding into whatever that kidney failure might have been caused by, and sort of a systematic approach. So it's interesting to see that sort of value of specialization. At the same time, we've also seen the value of that broad interdisciplinary look at healthcare.
For sure. I think once you start entering into the world of complex comorbidities, and it's not just simply one diagnosis of diabetes or heart issues or cancer, then that entire system kind of goes out the window, and you have to go to the hospital because you might have the potential for an urgent event that they cannot treat in a kidney center for dialysis, right? Like if you suddenly have a heart attack, it's going to be very difficult to do open heart surgery when you're only geared to do kidney surgery, right? And so it becomes, the sickest of those populations, the ones with a lot of complex comorbidities, and frankly, the oldest still would be forced to go to the main hospital centers. But at least I think would say it reduces the load that those hospital centers see and reduces the risk that patients with one or two underlying comorbidities would have in going to hospitals.
Excellent. So to conclude, Jay, can you give us what are the positive upside or some of the best things you've seen coming out of this? There's always silver lining. Give us some silver lining in terms of COVID and seniors and what we can look for going forward.
Well, I would say for MemoryWell and for what I do, when I started MemoryWell, it was because my dad had Alzheimer's, and I put him into a senior living center, and nobody knew anything about him. They asked me to fill out this enormous 20-page questionnaire about his life, and I was sitting there struggling to write down the answers to these questions, thinking, I'm a writer with Time magazine, and I challenge anybody to answer some of those questions well, like describe your parents' 50+ year marriage in 4 lines. And B, who was ever going to read and remember 20 pages of handwritten data points for like the 100 residents there, especially when all of these communities experience more than 75% staff turnover annually. There's a huge amount of churn with the staff in these communities. And so, I think that there's been, when I started MemoryWell 3 years ago, there was a lot of sort of like, oh, that's weird. Why would we want to know about our patients? Why do we need to know about who these people are? And I think that now, increasingly, we've seen a push towards what people call person-centered care or value-based care. And the government's been incentivizing it. So 30% of reimbursements for the Centers for Medicare and Medicaid go towards value-based care, things like what we do. But it is still, I think, it is this moment, I think, of COVID and the leap to telehealth where it's going to be really forced through because, you look at like healthcare in America today, never has trust between patients and doctors been so bad. Like every poll shows that patients don't trust doctors. They don't believe what they're saying, especially amongst minorities. There's a real hesitancy to go to the doctor. They don't believe that doctors are prescribing things that are good for them, that they're doing what's in something, the things that are in their best interest. And so if you don't have that trust in the system, it makes that leap to telehealth even more difficult, right? Because patients who were already hesitant to go see a doctor, in person now are really not going to trust what the doctor says when they're, over a telephone Skyping with one another. And so if you don't have empathy in that system, you don't have trust, it's really bad. And so I think, we're going to see a push to really do at least address a lot of what we do, which is knowing more about your patients, knowing more of who they are. And I think that the standard should be that every single person should have a biography or some biographical details in their healthcare records so that you know who they are and you're treating a person and not a diagnosis, right? And so you can actually build trust and you can have conversations about what you're doing and why that might put you at risk and who you are, rather than just like, okay, here's your diagnosis, here's your medicine, that's it, thanks. And so I think finding a way to sort of rebuild a lot of that lost trust in the system is going to be essential as we sort of make this really permanent leap to telehealth.
Right. So really humanizing the healthcare process is one which reminds me of, some of the nurses and doctors treating COVID patients with the full masks and suits on now have special faces that they put on to make it so that they are it's clear. Oh, sorry, my lunch has just arrived here. Thank you very much. Which I think is sorry.
I said bon appetit.
Thank you very much. Okay. Well, thank you so much, Jay, for your time. That was really fantastic and great work with MemoryWell, and look forward to hearing more about it going forward.
Thanks so much, Thomas. Take care.